What I can say is, as an intern during kind of the initial COVID um, crisis, we definitely felt super supported as residents. There was a lot of uncertainty, and our chiefs actually did a lot of the heavy lifting, making sure that all of us, especially at the junior level that were still in the hospital, were super well protected, very well supported. We did a lot of things very quickly to help support the residents, including, like I said, making sure that we had sort of clear leadership from the front with our chiefs, as well as then one of our attendings, Don Coleman, kind of serving as the residents' voice amongst the faculty and all of the higher up meetings that were occurring to make sure that the residents were being considered and taken care of during COVID. We did a lot to get residents out of the hospital. We found that, there's a lot of redundancy in a lot of our teams, and how could we get people out, keep people safe, keep people at home. And we all created different types of schedules to support ourselves as well as our patients during COVID. And then we also just did a lot of things to make sure that people that had families, that had children, that had medical conditions that made them higher risk were not in high risk areas, like seeing consults in the ED or taking care of COVID patients at all. And then the university also did a lot to help us as well, as far as offering up housing for people that couldn't go home. One of our co-residents actually, his girlfriend at the time was working in the medical ICU, and they didn't want to accidentally expose each other, and so he actually stayed at our Med Inn, which is our hotel that we have at the hospital, for 2 weeks, and that was completely provided by the hospital and by the university. And so I think with as much uncertainty as there was during COVID, I felt very like there was someone always taking care of us, someone always looking out for us and making sure that we were keeping ourselves safe, keeping ourselves healthy. And also just we did a lot of things to help support each other, as far as family nights on Zoom. Brooke had, can't remember if it was Tuesday or Thursday night conferences with all the juniors every week, just to make sure that we were still all doing okay, and just had a social hour every week. So we did a lot to help each other. And I think that that's a really important question, especially during this interview season, is in times of crisis, how do programs look out for one another and take care of each other? And I can say, I think we did a pretty good job.